Next is about Athato vishuchika prtaishedha adhyayam vyakhyasyaamah yathovacha bhagavan dhanvantarihi. Vishuchika, the word is often misunderstood as many times it's represented as a alternative word for cholera. But I think that's not a very correct translation. The vishuchika is a variation of clinical, maybe the physiological conditions which is produced due to abnormalities of the food, maybe something like the food poisoning. Now, again, complications of that indigestion or dyspepsia, abnormalities of the digestion, or it's also called as functional dyspepsia, could be ajirnam, amam, vistabdham, vidagdham, yadiritam, vishuchi alasakau tasmad bhavet chapi vilambika. Mainly the ama or that indigestion can produce a vistabdha or vidagdha. Either there could be a situation of abnormality of the motility or there could be an abnormality of the digestion. That vistabdha is where there is an abnormality of the motility, or it could be the digestion. Mainly two variety complications can occur, and if these complications are not treated immediately or managed immediately, they can result in vishuchika, alasaka and vilambika. The vilambika is where there will be a delay in the transition. The movement of the food in the gastrointestinal tract would be delayed. Alasaka is when it is stagnated, blocked, and there could be more of distension. Vishuchika is when there is a increased movement and expulsion, maybe something like the diarrhea. So the complications of the indigestion could be where there could be accumulation of vama, could result in either vistabdha, a delay in the movement, or vidagdha, abnormality of the digestion, and they can further lead to vishuchika, alasaka and vilambika. Now, the clinical symptoms could be suchi birivagatrani tudan santisthale analaha tasya ajirnena savidyehi uchyate iti vishuchika. The word vishuchika is because of the patient feeling the pain as if he is pricked by the needles. Now, many times that's exactly the point. Many times it is translated as cholera or so on, but it is not that kind of a symptom. Instead, the patient would have a pricking sensation throughout the body due to the ajirna, due to the improper digestion, and there could be the movement of the anila or vata could be delayed or slowed down. And natam parimita aharaha labhante viditagamaha mudastam ajitatmano labhante kalushashayaha. If a person has a regulated food intake, parimita ahara, regulated food intake, such and viditagamaha, who knows his limitations and his plus points, such a person would never get these complications. Only mudhaha, ignorant persons, or ajitatmana, who do not have a self-control, they develop these and their organ system would be affected. Kalushashayaha, they could develop these complications. The clinical symptoms would be murcha atisaro, vamadhu, pipasa, shulam, brahma, udvestana, jrimbasaha, vaivaranya kampo, hridaya rujascha, bhavanti rasyam, shirasascha bhedaha. The other clinical symptoms of vishuchika are either there could be murcha, impaired consciousness, or atisara, there could be even diarrhea, vomiting, or thirst, or there could be pain, or there could be giddiness, or the patient may have cramps in the body, udvestana, cramps, yawning, burning sensation, discoloration, tremors, or pain in the chest, any of these. Now, these are the typical symptoms which we see in case of what we call as food poisoning. The gastroenteritis, the other word which is used is. Kukshihe anahyate atyapam pradhamyati vikujati niruddho mardaschapi kuksho viparidhavati bhatavartyo nirodhascha kuksho yasabhasham bhavek tasya alasakam madyaste krishna udgara avarodhaka. In alasaka, there would be distension of the abdomen, and even there could be barborigmy, increased peristaltic sounds, loud peristaltic sounds could occur, and there could be niruddham margaha, the movement of the food peristalsis would be slowed down or reduced, or it could be kuksho viparjavati, there could be a retrograde peristalsis, a peristalsis which could move in an opposite direction. Viparidhavati, viparitena dhavati, it could move in the opposite direction, and the Vatavartya Nirodhashta, there could be an obstipation. That's a typical sign of a subacute intestinal obstruction. So alasaka is something like a subacute intestinal obstruction which is resulted due to the abnormalities of the digestion or stagnation of the food substances. The obstruction produced due to other conditions could be Baddha Budodara. So the difference would be in a Baddha Budodara there is an obstruction of the lumen of the intestine due to the maybe external causes or mechanical causes. Whereas in a feeling of obstruction is also called as a pseudo obstruction. The other word used now is a pseudo obstruction. Is the typical features of alasaka, and that's a what we categorize as a functional dyspepsia. Now, in the current methodology of classification, the functional dyspepsia is mainly categorized into two categories: that postprandial fullness or the epigastric pain syndromes. The two categories are epigastric pain syndrome or postgastric distension syndrome. That's exactly the vishuchika and vidagdha. The vidagdha is epigastric pain symptom, and vishuchika is the postprandial fullness or postprandial distress syndrome conditions. And there will be usually, as per the data, the patients who have this functional dyspepsia is a temporary phenomena produced after consumption of abnormal sort of the food, and there could be abnormal digestion process that can present with any of these symptoms, either postprandial distress syndrome 38% usually, epigastric pain syndrome in 27%, and there could be overlapping, that's around in 38%. That's an average incidence of the symptoms as such. The symptoms which occur in case of postgastric distress syndrome would be early satiety, bloating, nausea, vomiting, or decreased appetite. That's exactly what we see in case of the alasaka or vilambika conditions. Whereas epigastric pain syndrome, there will be epigastric pain or epigastric burning, which could be even seen in the vishuchika. दुष्टं तु भुक्तं कफमार्ताभ्यां प्रवर्तते नोर्ध्वम् अधश्चेस्य विलम्बिकां तां दृशदृष्टिचिकित्साम् आचक्षते शास्त्रविदपुराणाः. Vilambika, again, the food which is consumed and which is not properly digested, it doesn't neither move up or nor down, it gets stagnated over there, but no obstructive symptoms. That's the Vilambika. That's exactly what we see the postprandial syndromes. यत्रस्थमां विरुजेत् तमेव देशं विशेषेण विकारजातेहि दोषेण येन अवततं स्वलिङ्गैः तं लक्षयेत् आमसमुद्भवेश्च. The patient may feel the pain in any region of the body depending upon the location where the blockage has occurred. Like either it could be in the epigastric area, or it could be in the lumbar area, or it could be in the pelvic area, depending upon the location where the obstruction has occurred. It's not really obstruction, but stagnation has occurred. And the clinical symptoms also may slightly vary according to the dosha. यश्यावदन्तवोष्ठनखो अल्पसंज्ञः छद्यर्दितो अभ्यन्तरयातनेत्रः क्षामस्वरः सर्वविमुक्तसन्धिः यायात् नरः सो अपुनरगमाय. Such a patient who has that alasaka or stagnation of the food in the intestines and the peristaltic waves have become sluggish, if he develops the cyanosis, shavadantavoshthanakah, cyanotic symptoms have occurred, and his consciousness is impaired, altered consciousness occurred, or there is a severe vomiting, or there is a sunken eyeballs, sign of dehydration, or his voice is not proper, the voice has become low intense voice has occurred, or he has a his joints have become now lax as such, that's the tone of the body has become reduced. Such a condition can result in fatal complications. So apunaragama is a nearing death condition, irreversible condition. So that condition becomes irreversible. That's a very advanced stage of toxicity, the toxemia could occur. Sadhya. So पार्ष्ण्योः दहनं प्रशस्तं अग्निप्रतापो अमनं च तीक्ष्णं पक्वे ततो अन्ये तु विलङ्घनं स्यात् सम्पाचनं चापि विरेचनं च. The treatment protocol in such conditions of vilambika and alasaka, particularly alasaka, would be vilambika and alasaka, both the conditions. Sushruta says the treatment of parshnya dahana, agni karma over the heels, and or heating the body, agni pratapaha, that's the swedana, maybe heating of the body, temperature has to be raised in the body, or tikshna vamana has to be given. And then once that food has become digested, Langhana has to be done, and then Patana and Virechana could also be the other options of the treatment. Vishuddha Dehasi Sadyeva Murchati Saradihi Upeti Shantim. Once the dosha has become clear, or that accumulated toxic food substance has become cleared, patient would recover from all the other complications. Astrapanam chapi vadanti patyam sarvasu yogan aparami bodha. Other Astrapan Basti also is suggested, and some of the other yogas which are suggested are Pathya, Vacha, Hingu, Kalinga, Gunja, Savarchale Hisati Vishesha Churnam, Sukhambupitam, Minihanti Ajinam, Shulam Visuchim, Aruchincha Deha. In the Vishuchika Shula, that's a pin pricking type of the pain produced after consumption of a abnormal sort of the food, can be treated with the Pathya, Vacha, Hingu, Kalinga, Savarchala, Lavana or Ativisha Churna, the Churna prepared of these. Ksaragadam va Lavanam Vidam Gudapragadhan Atha Sarshapan va Amlena va Saindava Hingu Yukto Sabija Churno, Sabija Purno, Sagrato Trivargo, Katutrikam va Lavane Upetam Pipes Muhikshira Vimishtam to Kalyanakam va Lavanam Pipetu Eduktam Adav Anilamesho. Any of the yogas which are mentioned in the Vata Yoga, very specifically Ksharagada or Vidalavana or Sarshapa with Buddha or Saindava Hingu with Amlarasa Dravya or with Grita and Trivarga. Trivarga is Madhu Grita and is Buddha. Katutrikam Valavanam or Trikatu, I with the Lavana with the Snuhikshira or Tishnamshira or Kalyanakakshara. These could be the other options of the treatment. Other options of the treatment are Krishna Demoda, Kshavakani Vapi, Tulya Upivek Magadha Nikumbho, Danti Yutam Magadhodbhavanam Kalkam Pibet Koshavati Rasena, Vishnabhi Adbihi Magadhodbhavanam Kalkam Pibet Nagar Kalka Yuktam. The other options could be the same Ajamoda, Kshavaka, etc. with Danti, the Virechana Dravyas. Then Vyosham Karanjasya, Palam Haridre, Mulam Samam Chapi Athama Atulungayaha, Chaya Vishushkaha Gudika Kritaha, Hanyo Vishuchim Nayana, Suamitam Sasu Virechitam Va, Sulangitam Manujam Visitva, Peyadipi Deepanapachini, Samyak Shudhartam Samupakarmeta. The other yogas which could be given are the Trikotu with Karanjapala, Haridram, etc. With Matalunga, with preparation of a Gutika tablet with moderate dryness or in maybe shadow dried Gutika prepared out of these could be given, and it's considered to be one of the options, and which could also be given in the form of Anjana into the eyes. Then Vamana, Virechana and Langhana have to be given once the patient has recovered from this Vamana, Virechana and Langhana. Gradually the patient may be given the Samsarjana Kramahara, Peyadibihi, that this Manda, Vilepi, etc. can be given in the sequential order, and they manage like Amam Shakradvanichilam Kramena Bhuyo Vibuddham Vigunanilena Pravartamanam Nathaswam Enam Vikaram Anaham Udaharanti. Anaha is another of the complications that can occur, and in that condition there would be retention of the fecal material which is not properly digested, and it also results in abnormal movement of the flatus. Such a condition which is the motility disorder. The motility disorder, some of those motility disorders which we have discussed in the previous context, they could be the anaha. Tasmin bhavanti amasamudbhavetu tashna pratishyaya shirovidaha amashe shulam atho gurutvam sallasa udgara vikhatanam cha. If it is in the amashaya, in the amasamudbhava anaha, the patient would have trishna, excess of thirst, or even there could be nasal discharges, burning sensation in the head, and the pain in the upper part of the abdomen, heaviness, or even salivation, and not able to have the erectations or improper erectations can occur, inefficient erectations could occur. Stambha kati pristha purisham utre shulo atham murcha shakradvamyacha shwasascha pakvasheje bhavanti lingani tatra alasako bhavani. When the ama results in alasaka, severe alasaka, there could be a spasm of the muscles in the lumbar area, and the pain during defecation as well as micturition, even impaired consciousness can occur. Even patient may have a fecal vomiting and breathlessness could occur. And these are the clinical symptoms of alasata due to ama. Amadbhave vantam upakrameta samsarga bhakta kramadipanihi. In the ama conditions again, the treatment has to be vamana followed by samsarjana krama. Atha itaram yo nashakradvamettam amam jayet swedana pathanisha. If it has not gone to that level where the patient may have fecal vomiting in the early stages, the patient may be treated with the swedana and pachana. विशुचिकायां परिकीर्तितानि द्रव्याणि वैरेचनिकानि यानि तान्येव वर्तीः विरचयत् विचूर्ण्या महिषै अजा आविभगवां तमूत्रं स्विन्नस्य पायो विनिवेशताश्च चूर्णानि येषां प्रथमेत्तु नाड्या. The protocols of the treatment mentioned in the vishuchika also can be given in the form of virechana dravya, or their varti could be prepared, a suppository could be prepared with the urine of animals like buffalo or maybe goat or even sheep and so on, and it can be suppository is given so that the fecal movement is facilitated, or the churna powder that could be blown into the rectum. Mutreshu samsadhya yatha vidanam dravyani yani urdhvam adhascha yanti क्वाथेन तेन आशु निरुहयच्च मूत्रार्थयुक्तेन समाक्षिकेन त्रिभण्डियुक्तं लवणप्रकुञ्चं दत्त्वा विविक्तक्रममाचरेत्. The other option could be the same medicines which could be used for vamana or virechana, the vamaka or virechana ganadраvyas could be processed with the gomutra, or their katha kashaya could be used for niruhavasti with gomutra or with the makshika. And then the patient has to be followed, the protocols of the virechana, samsarjana krama has to be followed. Eshveva tailena cha sadhitena praptam yadi syat anuvasaycha. With the same drugs, taila could be prepared and anuvasana basti can be given. Now, from the current, there is a nice guideline for managing the dyspepsia, particularly functional dyspepsia. Now, the Rome guideline, it has divided that functional dyspepsia into two categories, but more advanced but not so popular guideline is a big NICE guideline. In the NICE guideline, the management of dyspepsia is categorized based upon their clinical symptoms, presentations, which are very close to what we see from Ayurvedic point of view, and they are categorized as patients presenting with it's a epigastric pain syndrome is further again categorized into predominant heartburn or nausea, vomiting, or epigastric pain syndrome where the patient may have more of epigastric pain. Then the postprandial distress syndrome is further categorized into further subcategories. Now, for the sake of practical convenience, this is something which is very relevant, which we can use in our practice and which I use in my practice. In the patients who present with the predominant heartburn conditions, the current your standard prescription by the NICE guideline would be lifestyle modification and proton pump inhibitors, but proton pump inhibitors are not the real choice. I would be using Sudhashekar Rasa or Arogyadini in proton pump inhibitor related abnormal. Now, it's very interesting is proton pump inhibitors drugs given for a long duration same can produce the symptoms of this. In such conditions, Arogyadini is a better option. Kamaduga and Godanti Avipattikara is the usual prescription. Patients presenting with the epigastric pain syndrome conditions, my treatment would be Agnitundi, Sudhashekara, Godanti and Avipattikara as such. Whereas the postprandial syndromes again further categorized in that guideline as delayed gastric emptying and accelerated gastric emptying or normal gastric emptying conditions. Delayed gastric emptying condition, patient would have more constipation. The patient would not pass the stools maybe once in 2 days or 3 days or so on, delayed. Accelerated gastric emptying, there could be patient may have more rapid movements of the stools, maybe increased frequency of the stools. Normal gastric emptying patients would have more of distension and pain as a symptom than really the constipation. Now, my prescription would be in the delayed gastric emptying conditions, Agnitundi, Arogyadini, Jirakartirishta or Kumariyasava. Whereas in the accelerated gastric emptying, Sudhashekara, Aranda Vedavi, Bhunimbadi Kota or Mustakarishta, Smithsagarasa if necessary, because these patients would usually have stress as a symptom. Then in the patients who have normal gastric emptying conditions, it would be Agni Tundi, Aragyavardhini, Chitrakati and Kumari also with the Smrisagarasa if necessary. With this, we will conclude this chapter. Sushil Samhitam Uttaratantrante Kachikisarante Vishuchika Pratishedho Nama Ashtadashodhya Aditha Shatpanchashattamo Adhyaya 56th chapter over. With this, we will conclude today. If there are any questions, I will try to answer, and then bit early, but anyway, right, there are not any questions, so